Hello and good morning. Thank you for joining us for our continuation of our 2020 webinar series. This is Jason Anslanian, Membership Experience Director of the Medical Fitness Association. Thank you for attending today's promotional webinar titled The Hows and Whys of Facility Certification by Deb Riggs and Alan Lloyd. Before I turn this over, please remember you were sent a copy of the presentation yesterday along with a checklist. Please type all questions in the question section of your toolbar throughout the seminar. All questions will be answered at the end in the order they were received. Please remember this is a promotional webinar and no CECs or CEUs will be given. Deb and Alan, please introduce yourself and we look forward to hearing your presentation.
All right, thanks, Jason. Well, good morning, everybody. This is Alan Lloyd. I am the Executive Director at Beacon Health and Fitness. We have 3 medically based fitness facilities in northern Indiana. And so that's my day job. And then I also help out with the MFA in a variety of ways. And so I've served on the education committee, the certification committee with MFA, and then also am a facility examiner, which is an exciting opportunity to get to visit other clubs and walk them through this examination process. So that's a little bit of my background, but I'd like to introduce as well to you Deb Riggs. And Deb, if you could share a little bit about yourself.
Sure. Good morning, everyone. I am Deb Riggs. I'm a retired director of the Tri-Health Fitness and Health Pavilion in Cincinnati for 30 years. I served on the board of MFA for 6 years. I am also an examiner for MFA for the certification. I've been on the certification committee for many, many years, and my center in Cincinnati was the first to be certified, and we have been through the certification process 4 times now. So I'm excited to share information with you today, so I'll kick it back to Alan to get us started.
Okay, great. Thanks, Deb. So as we move through today, this is a lengthy presentation, but we'll move very quickly. And so as Jason mentioned, we certainly welcome questions towards the end, but I'm not going to read every slide to you, but again, you do have these available to you so you can go back and reference them. Some of the key things that we want to be sure to address today in the presentation, we want to discuss why your center should become MFA certified, how to prepare for that certification, the overview of standards and guidelines, and that's really where we'll dive into some of the detail level information, and then learn a bit from experienced examiners and directors of these facilities, okay? So when we talk about MFA certification and why you might want to consider this for your facilities, there's several bullet points here that you can read through, and obviously many of these are very important. Differentiating, I would point your attention to in the middle of the slide there, differentiating your center from local options is really an important point. And you're already differentiated if you're affiliated with a health system. And we can talk more about that, but I wanted to highlight that one in particular. And then also there at the very bottom, the good housekeeping seal of approval, we call it, which is important because you're able to then confidently say that you have established your facilities with these very specific quality metrics. And frankly, there's just really no other way or mechanism within the industry to do that. And so that's part of what this provides you as well. So as you're looking to get started, you'll want to definitely gather some materials. And one of the most useful is the standards and guidelines for medical fitness center facilities. And this is updated periodically, but this really goes into great detail about each one of the areas of emphasis for the exam. And so that's a useful resource. And I would say, quite honestly, even for people that aren't pursuing certification, it's a great resource as well. Just in understanding some of the quality metrics and safety measures and that sort of thing. So then you would move towards the facility certification application itself, and that's an online process and would connect you with the MFA office. There's a self-study checklist that will be sent to you, and then it's a matter of starting to gather some of the documentation about what you're doing. And really what we found is, generally speaking, this is about a 1-year process. And in some instances, the requirement is that you have this documentation for a full year. So it's not something that you want to do in a rushed or hurried fashion, but strategically something you want to implement into your operations as you move forward. And then, of course, you submit the official application and the application fee. And throughout this whole process, I would just share with you that the MFA office will work very closely with you and make sure that all your questions are answered and that you feel good as you move through each step. Okay, so the application itself, you can see the fees there. And if you're dealing with your initial certification or other facilities, you can see a breakdown and a differentiation there. Payments can be broken down into 3 separate payments, as you see. So that's one of the first questions we get, so I always like to see that up front on the slide here. And then we move to the review and certification materials. That's where the first phase of payment is due. The certification prep work, and this is really the meat of the work, is making sure that you're ready. And our objective before we send examiners out there is to have already looked at things and feel confident that you are aware of each requirement and there aren't any surprises when that examiner site visit comes up in step 4. The site visit is typically about a day and a half. So the examiners come in on the evening before, late afternoon, evening, and then they'll meet your team bright and early the very first day and walk you through that process. And then the second day is a half day to finish things up, and then they're on their way. After that, the examiners will submit their report, and so the examiners don't make any formal decisions themselves. And so everybody on these site visits wants to find out, you know, did we pass, that sort of thing. The examiners don't know that answer, and they're not able to give you any indication in that regard. Instead, what they do is forward this onto the certification committee, who reviews it, and then the certification committee makes a recommendation to the board of directors. And they're actually the ones that do the final review and the official approval. So it's a multi-step process, but once you get that examination completed, it does move through the system rather rapidly. Okay, so some prereqs, and these are really pretty basic, but your facility does need to be a member of the MFA and operational for at least 1 full year. And there are some key pass-fail requirements, and we'll look at those a little more carefully today. So it's based on a point system, and you have to earn a certain percentage of points in order to pass and to become certified. But then there are very specific items that just simply must be in place, and those are the pass-fail. And like I said, we'll look at those a little more carefully in a bit. So a highlight of some of these pass fails and active, and I would say this first one is really the absolutely key, an active medical advisory committee or medical director, and a relationship with local continuum of care. And so if you don't have that in place already, I would really reach out and talk to the MFA, and they can guide you on what some best practices look like in that regard. But that's really the foundation of a lot of this. A systematic quality management process to assess performance and outcomes. And you probably have much of that in place already. It's just something we want to make sure each one of these areas is represented in. And of course, an emergency response plan, including testing regularly and placement of AEDs and training and that sort of thing. The next bullet point is an area that we'll want to spend a little bit of time on, and that is having at least 3 clinical/fitness programs with inclusion/exclusion criteria, intake, and follow-up. And I think, Deb, in our conversations, you've indicated to me that's one of the areas that people get tripped up on the most. Is that right?
Yes, and we work with you to make sure that you've got that complete before an examiner would come on site. Typically, one of those clinical fitness programs you submit with your application so that we know that you're on the right road.
Yeah. Okay, and then properly educated and certified staff, and so there are clear expectations or requirements related to that. And so then after you've passed that first or initial certification, then the recertification process occurs every 3 years. And that reevaluation looks very similar, but depending on the size of your club, the MFA may send out just one examiner or two, but it's again to review these same criteria and make sure that they're all in place as they should be. One of the things that I've found as a facility director that's really helpful is at the end of this certification process, you get some areas of, or you get some feedback on areas of improvement and that sort of thing. And then when you recertify, we'll follow up as examiners on those and see how you've done with those. And like I mentioned, as a director, that's just invaluable feedback for me. And if you think about it, you're getting these experts, these people that are running clubs in other areas, they're coming in, they're spending a day and a half with you and your team, they're seeing your facility, and then they're providing some recommendations. And so it's really a tremendous opportunity there to get that feedback. The other part of the recertification is then providing documentation of these quality improvement and compliance with standards. And then of course, still the pass-fail guidelines are in place there to be followed as well. And so here's just an example, and this varies a little bit from site to site, but this is a sample agenda. And so you can see on day one, it starts bright and early, 7:50, 8 o'clock. The kickoff meeting is a really important time for our examiners to meet the core leadership of your facility, including your medical director. Then we move through a tour, start looking at the specific guidelines, have lunch with your staff. That's obviously changed a little bit right now due to COVID, and we do have protocols in place so that we're able to continue doing examinations during COVID, but with some changes. And lunch being one of those. Continue that in the afternoon, start meeting in groups with your team, so your fitness staff, personal trainers, aquatics, group X, all of those. Again, trying to get a feel from them about the operations of your organization and their involvement in the certification process. And if I can, I'd just like to pause real quickly on that, and you want to make sure that you're including your entire team in this journey. Don't let it reside with just one or two key people and then announce that the examiners are coming. You want to be sure that everybody's engaged throughout the process and feels involved. And then lastly, on day two, the examiners again show up first thing in the morning. They review the findings from the previous day, do a final review of the guidelines, and then have a summation conference where they share some of what they found with you and your team. So the scoring is important. There are some instances where you may not have a service. For example, if you don't offer babysitting, then that section just won't apply. And so you won't be dinged for those points that you didn't earn. But you do need to get a 90% score in order to pass. And so that's what you're aiming for. And so you can see then here would just be an example, a maximum score of 148. You had 4, let's say, situations that didn't apply in your facility's case, and that's not a problem. So your possible is 144, and you want to get 90% of that is how that works. And I can tell you that over the years, we've honed this down quite a bit and refined it and gotten feedback from our participating clubs and that sort of thing. And so I don't recall off the top of my head, but we used to have, what was it, Deb, you recall 250, 300 possible points, and now it's been
well over 200 guidelines, so we've scaled it back.
Yeah, so that makes it a little more streamlined.
There it is, 209.
209, yeah, there's our. Okay, so that gets us through that phase, and I'm going to turn it over to Deb now, who's going to move you through these next sections.
Okay, so again, like Alan said, this is a team effort. Don't take all of this on yourself, but start looking at that scoring sheet, and I think Jason may have sent one to you. I think when you go through that, you can probably just go through and say, yeah, we got that, we got that, we got that. But then you want to start building your binders and showing the proof that you have it. So if you want to scroll down one more page, Alan. This is an example of how people put together binders. So one binder for each of the, I'll call them chapters, and then you'll want to develop tabs for each one of the guidelines. You might want to start saving things electronically because I think that's going to be the future. But again, it's just another copy of what people do. You want to keep it organized. The more organized it is and the easier it is for the examiners, the quicker your day will be. And then again, we talked about team effort. Once you're about a year out is when you should start making sure that all of your paperwork is being documented. So things like meeting with your medical director quarterly. So starting to keep those agendas and your minutes so that you're not running around at the last minute trying to find things. So the more your staff knows what you're looking for, the better. And then about 9 weeks out is what I had done is I developed some cheat sheets and some weekly meetings. So 9 weeks, why 9? Well, there's 9 different per se chapters. So each week on a Monday, I would meet for an hour with the people that were affected by that chapter and quiz them and make sure that everybody knew what was going on. So it's just a good way, again, of training and not making it be overwhelming at the last minute. So now we're going to dive into our chapters. And Alan talked about the pass-fail, so I won't reiterate on that. But again, the minutes of those meetings that you have quarterly, they have to be documented because we're going to look at the agendas, we're going to look at the minutes, and we want to make sure that all of those guidelines are being discussed with your medical director. Next. So again, here's just an example of how you show, like you might copy off of your web page that you do have an advisory board. So you've got to prove everything in writing. Here's an agenda of a medical advisory meeting, but then down in the agenda, you'll want to show that they looked at the emergency procedures and that they were approving different policies. Okay. So this one gets a little sticky with some people. They find it hard to understand. So on the bottom, the second bullet, it says, regardless whether the program is owned or operated or renting space, your center must provide proof of compliance such as joint commission. So if you have physical therapy in your facility or cardiac rehab, you have to show that they have an approved or a proof of compliance, that they are compliant with the Medicare, Medicaid, or Joint Commission. They will be able to provide you with that information. If you're stuck on this and you've got questions, please call Bob at MFA and he will help give you examples. Next. Again, there's the other pass-fail that Alan talked about a little bit earlier. And this might be what you submit as showing your organizational chart and where you are, maybe as a director, and who do you report to, and what is your relationship with the hospital. So providing an org chart would work there. Next. And then again, you have to show how you work, how your mission statement, how you work with your community. So this was my mission statement. Go ahead, Alan. And then just some examples, some copies, pictures of what you do to provide programs and services to the community. Okay, Alan, you're up.
Okay, so then section 2 here, when we look at the quality management standard, and this is a pass-fail, but the center has policies and procedures that ensure all programs and services provided by the center are effectively contributing to the center's mission. Collaborative process for creating and implementing new programs and services, and then demonstrate general health and fitness goal compliance for individuals. And that one can be a tricky one. Sometimes it's likely something you're already doing, but are you documenting and measuring it in ways that then you can prove it? for the examiner's benefit. So some examples of quality management and what that might look like. Outcomes being measured, obviously, Sentinel events and responses to those, individual member and user outcomes. Retention is a big one there oftentimes. And then the performance of the center, looking at the budgets, financial ratios, that sort of thing. And really a lot of this stuff, it's not so much that there are exact numbers that you need to hit. We just want to see that you are watching those performance metrics. So again, an orientation is key. As you can see there, exercise testing, and then recommendations, and then monitoring and feedback. And then the retesting is also a hallmark that's really important for a medically based fitness facility. So these are just some examples. You've probably got these within your own organization, but dashboards, things like that. And we're really not looking for you to recreate any of this stuff to fit into an MFA model. We just want to see the dashboards that your organization has created. And then one of the very best resources that you can get your hands on is the benchmarks for success. This is the 2014 edition, but these come out periodically. And this is really valuable information. And as a MFA facility, you can participate in this as well and help us with this data collection. So here's an example of that. And in fact, this is one of my favorite slides, and I use it quite a bit. But if you look here, it's comparing IRSA facilities and MFA facilities. And so you can see some really interesting data and differences there. And like I said, we use this particular slide and have put our own clubs onto this so that we can track it relative to both the MFA and IRSA facilities. Member survey results. So you're probably already doing some surveying, but we'd like to see what that looks like with your membership base. But then, of course, the survey is good, but the action plan is really the key. And how are you implementing some of the improvements that the surveys have revealed to you? So you can see an example here of one of those. Quality management outcomes. And this is a good slide, a good example of a particular program. This is the Life Steps weight management program. And you can see some of the benchmarks that they looked at related to quality. And so obviously, participation numbers, completion percentages, how many were non-members of those, how many converted to membership, that sort of thing. The pre-activity screening is really important. And these are pass-fail areas, as you can see. So anything in red is pass-fail. This involves not just the screening process, but then waivers if they're not participating in the screening, and exercise testing. The key there is—
Want me to pick up here?
Yeah, if you could, I'm sorry. The key there is the members being offered the orientation, right? Yeah, go ahead.
Great. So again, this one is a good binder to give to your fitness director and have them start building it. But you do need to show that you have some way of pre-screening people. So an example of your PAR-Q, but also how are you risk stratifying? How does the staff know if someone has additional risk factors that then require a medical physician referral form? So you put in different examples of your forms that you have. Next. And then again, your HIPAA compliance, you want to make sure that every member that signs in also has a HIPAA form. And as examiners, we may ask you to pull up a membership file and just show us. So you got to be prepared with all of your files. We have to make sure that we have assessments available. And how are you marketing the fact you can't just say, yeah, we have assessments, but show us where you let your members know that an assessment is available to them. Next. Now we get into risk management and emergency response policies. And one thing I always let people know is they always want to know, what is the value of going through all of this? You know, you're paying a lot of money, you're spending a lot of time. I think this is one of the most important. I think if you can show for liability reasons, everything that you and your staff are trained on and that you're doing, this could keep you out of court and save you from any lawsuit. So making sure that your center is complying with all of these are pass fails, just because it differentiates our centers from regular centers. So making sure you have appropriate emergency situations and that all of your team members, first, second, and third responders, are consistent in how they would respond is very important. That everything is well documented and easily accessible by your staff at all times on all shifts so that everyone knows how to handle all emergencies. And that you are then documenting emergency drills. We did drills frequently, and the team members were a little afraid at first when we would just walk up and say, this is a mock drill. But by the time the examiners came, they were so thankful. Thanks so much, because they felt very comfortable. Because as an examiner, we are going to do a mock drill, and we're going to ask them to respond. So having your team prepared is important. Having the appropriate number of AEDs, they have to be within a 1.5 minute comfortable walk is important. And then making sure every staff member that touches a member is CPR AED certified, and that the AEDs are maintained in accordance with the manufacturer. Next.
And if I can just share real quickly, we actually had an event yesterday in one of our clubs, and a gentleman went down and we had to perform CPR and an AED, and fortunately it all worked out, and he's recovering now at the hospital. But our staff literally came to us that afternoon and said, thank you for the training, we were ready. And that makes it all worth it.
You bet, you saved a life. This is just an example. I don't know if Stephanie's on, but this is from Hayes. Copy of their emergency plans, and again, appropriate to your area. We have tornadoes here, but obviously down south there's hurricanes, so you want to make sure that your team is prepared. Next. And then the AED, you'll want to show us where they're signing off on making sure that the battery's working. Next. Eye wash stations, emergency phones. Again, the eye wash stations in appropriate areas. And I would invite, this is another thing to document, that you've invited the fire department in and that they gave you a review of your center, have something in writing, that the health department has come in, invite them in, say, please look at our facility, put it in writing as to whether we're prepared. If your hospital or community has some type of safety compliance, ask them, you know, within a year to please come in, look at our center and give us something in writing that says we're compliant, or help us to be compliant. Next. And again, your signs can't be just your handmade signs. They have to be ANSI approved. You can find those online. Next. And then these are just examples of different signs, making sure that you've got handicap. When we go into some restrooms and there's not a handicap sticker on the handicap toilet area, even though we all know what it is, we still need a sign. Go ahead. Next. Your occupancy permits, make sure that those are posted in the rooms. Next. Different copies of signage. Again, that's our tornado sign, code blues, crash carts, anything that you want to have documented. Next.
Whoop, I lost.
That's
I got
okay.
ahead of it.
Yeah. Just again, with your policies, your required signage in the pool areas is your danger sign, your no diving, your underwater breath holding. Those are all important, and those are on your checklist. Next. Sign everywhere, a sign, but it's important. And your team needs to know, where the signs are and how to respond. Alan, you're up.
Okay, so section 5, programs and services. You can see again here a pass-fail requirement that will have a minimum of 3 clinical fitness programs for persons with chronic medical conditions. And as we talked about a little bit earlier, these need to follow nationally accepted guidelines, have appropriate inclusion and exclusion criteria, and then have an initial assessment and follow-up testing. And the good news is there are plenty of these nationally accredited or accepted guideline programs already in existence. So it's just a matter of finding the ones that work for your members and meet their needs. But there are lots of those out there. They've already been created. So then it's just a matter of implementing them appropriately. The inclusion exclusion criteria is pretty straightforward. And the initial assessment usually isn't hard. The challenge oftentimes comes in the follow-up testing. And so you want to bake that into your processes to make sure that you've got a mechanism for that occurring. Other examples, nutrition counseling, mental health counseling, educational workshops. You're probably doing a lot of those already. Having open lines of communication with your referral sources, and that's really key. And so you'll want to be able to document how that's happening. And then, of course, protecting PHI. This next slide, quarterly community member programs. Again, you're likely already doing a lot of that, so it's just a matter of documentation there. And exercise is medicine. Many of us are likely familiar with that, but that's a great physician-referred program that you can tap into. For the referral processes, some of you may be able to tie into electronic medical records. That's obviously a health system or hospital issue, but I know there's a facility in Kentucky that's done really well with that. Here's an example of some forms related to exercise recommendations and outcomes. So you'll want to tailor those to your needs. And then this physician follow-up is really important. And, just dropping a letter in the mail, and of course there are electronic ways to do this now and everything, but just keeping that dialogue open between you and the physician. And so letting them know what their patient is doing and that they've completed this program and it's been beneficial and you've got some metrics for them can really go a long way in solidifying your relationship in the local healthcare community and the continuum of care. And it's sort of a long-term strategy, but if it's done effectively, really can make some inroads for you with those physicians. Then, of course, a HIPAA form, that's important. And then we'll move to children and youth. Deb, you want to take this one?
Sure, no problem. So the children and youth, we have definitely scaled that back. I'd say one thing that you'll want to be sure of, and people miss out on this, is making sure that your medical director has signed off, and you need a copy that they've signed off on your program policies. So put your policies in your binder, but make sure that there's a signature from your medical director. Your medical director's signature is important, even like on your mock drills, on your emergency drills, on your safety reports that you have. So keeping that medical director informed and making sure that their signatures is important. So back to the kids, you want to make sure that they're on their pre-registration information, that it includes all of those things. So we will look at your registration form and make sure that there's, who's going to pick up the child, who's able to drop them off, are the allergies listed, sign in and sign out. So all those little things must be on your forms. So again, written procedures that include any of the parameters of your programs. What are the emergency programs specific to kids programming? So child abduction, and then of course, any of the first aid, the CPR, things like that. But anything specific to children is going to be, looked at. Choking, and is your team members ready for child events. Okay, scroll down. These are, the next one is just different examples of some of your activities. If you've got sport camps, and then some of the rules. And are the rules posted? What are the kids able to wear? And again, has the medical director signed off on that? Next. Some of your security is very important in your child care area. You know, are certain doors locked? Are certain cabinets locked? Is everything safe? You know, one thing that we had looked at is like some of our plumbing wasn't wrapped under our sink. We had stuffed animals that we had to get rid of just because of, you know, the different dust mites and things like that. So the examiners came in and gave us some, you know, helpful hints in our kids area. But how is your checkout policy, making sure that the right child goes with the right parent? So these are all examples, and I'm glad that Jason sent you the PowerPoint ahead of time, and that way you can keep this and use it as a resource. And then different fire emergencies, evacuation procedures, you know, what are they? And you'll copy that and you'll put that in your binder. Next. And now we'll jump to aquatics. And again, some of you may have pools, some may not, but we'll kind of breeze through this a little bit. But this is important because there are some pass fails. One thing to note, that written rules, policies, and procedures for each aquatic area. So if you have 2 swimming pools and 2 whirlpools, you need 4 policy binders for each of those areas. They may look similar, but they need to be ready and available for your staff to be able to pool at any time. But then also, is there something different in each of those areas that may not just be the same as your lap swimming? And then what are the responsibilities of the staff in handling emergencies in those areas? We had a whirlpool in each of our locker rooms. So what is the policy for people coming in, and how do you know that there's an emergency in that area? So it's very important. And then again, having drills and documenting the drills with, you know, all of your staff, who was in attendance, who wasn't, and how do you follow up with those that don't attend these team meetings? Are there information online? Is it emailed? And then the last one is the entanglement entrapment prevention, which is kind of old by now, but we all must still be compliant. MSDS is important in this area. We ask that you have hard copies of your MSDS sheets. We know that people can now go to the computer and pull it up, but how quick can somebody that has, you know, chlorine splashed in their eyes able to run to a computer, open it up, look for that MSDS sheet? It isn't going to happen quick enough. So especially in your pool areas, maybe your laundry areas, highly used areas for chemicals, that you have them written and easily available, and that the staff knows, what do I do with this MSDS sheet? Not just here it is, but how do I use it? So all that is in good training. You do have to have 1 CPO on staff, and make sure now that your Virginia Graham Baker compliant, your entanglement, make sure that they are still compliant. Ours expired, our drain covers expired, and we kind of forgot about that. So make sure that your drain covers are still compliant, that they're up to speed, and that you have documentation of that. Next. Just copies again of your MSDS. Next. And then different appropriate signages outside all your pools, your saunas, your whirlpools. You can get some of the information from your saunas and your whirlpools from your manufacturers. Next. And then I think, Alan, is this you or me? I think this one is me. This one's me. So
Okay.
this is a pass-fail, and on this one is extremely important too. So scroll down one more. You want to make sure on this that you look at the checklist very carefully and make sure, because some things have changed on this, that the appropriate staff, your fitness director, personal trainers, the people offering the clinical services like your cancer wellness, that they all have the required education and certification. This is a pass-fail. So if any of your fitness team does not have the college degree, or a personal trainer is not current on their certifications, then we can't even get into the building. So Alan, if you'll scroll down one, you can see this is a good way to make sure that you as a director, the fitness director, those in charge of the personal trainers and the aerobic team, your exercise group X team, keep a constant list of all of your employees, what their certifications are, when they are due for expiration, when is their CPA or CPR expire, any universal precautions, any of their licenses. This is vital, and you've got to stay up on this so that when we come as examiners, that no one has anything that has expired. So that's a good tool to use. Next. Same thing on universal training. I know all of us go through some type of annual education where you go through bloodborne pathogen that's usually required by the hospital. We will want to see a list of every team member and that their due date, that they are compliant in their annual training. Next. And this is you, Alan.
Okay, so facility operations, and a lot of this you'll likely already have in place, but it's something that as examiners will want to look at. The check-ins process and waivers, and these will vary a bit by your organization and also your health system, but we just want to look at these when we visit. Here's an example of a guest registration waiver. The facility operations themselves, of course, compliance with laws, regulations, and codes. Equipment spacing is often a challenge, and especially now with social distancing, but looking to make sure you've got appropriate floor and wall surfaces where indicated. A preventative maintenance program, as we all know in the fitness world, is key. Facility safety and security, or SDS sheets. And then the training on hazardous materials specific to the workplace, and we'll take a look at that. And of course, with pools and things of that nature, that can be rather specific. And then certainly your universal precautions related to blood and body substance. One of the examples that I like to use that when we were going through certification was really beneficial to us, and frankly, probably not something we would have been doing if it weren't for the MFA certification, but that is doing an annual accessibility survey for disabled and special populations that may visit your clubs. And we've gotten really invaluable feedback from that tool. And we have examples that we can provide you as well if you'd like help crafting one of those, but those are great.
Alan, if you want to go back up, here's another one that people miss, is that last bullet point on training appropriate to likely special pops encountered. So you do want to document that your staff, all of your staff, have some type of training for special pops. One example is we had someone come in and do some training, especially with our kids center on Down syndrome. You know, what are the likely, I guess, appropriateness of working with children with Down syndrome? What do they need? What can we do to assist the team members? So bringing in someone from your hospital, maybe organization or an outside agency, but documenting that training. And the team has really, really appreciated that. But maybe with Parkinson's. So you can bring in different topics every year, but that's one that people typically miss.
Yeah, that's a great point. So then this is the fun part. What do you get to do with this logo after you've become a certified facility? And you can see there, we certainly encourage you to celebrate this, not only with your team and your members, but with your community. So put the decal on your entry doors, embroider it on uniforms if you like, stationery, website, of course. Get some press out of this, make a banner, anything you can do to help differentiate and show people all of the great work that you and your team are doing related to the quality of your facility. And so here you can see Deb and her team, their Tri-Health being the very first certified facility, and that was great. And then you do receive a complete marketing kit. So we've put some work into making this as easy as possible for you to share this information. So I think this is the team with the new logo. Is that right, Deb?
Yes. Mm-hmm.
And then just incorporating this on your the marketing that you already do. So your web page, things of that nature. You can see some banners. And then absolutely celebrate this with your team. There's a lot of work that goes into this, and they should feel really good when they've completed this process and become a certified facility. So make sure that they know how much you appreciate them and how meaningful this is. And so any way to celebrate, take advantage of it. You'll see a lot of facilities get t-shirts made, that sort of thing. So make it fun. Okay. There you can see some details. And these are some clubs that we used examples from, so we're grateful for them allowing us to do that in the presentation here today. And we have a whole team from MFA that works on these sorts of things, so we just want to recognize them here. But a lot of people to support you and help make this journey a beneficial one for you and your club. So before we turn it over to questions and answers, we wanted to leave enough time for those. I just wanted to briefly say that if this is something that you take on, I can promise you one thing, and that is that it will make your club better. It gives you very specific targets to shoot towards. It allows you then to manage towards those targets, and then creates an expectation, I think, of excellence throughout your entire organization with your team. So that would be my pitch, is that if nothing else, you'll come out of it a better facility than you are today.
Yeah, and I'll add the value that I've seen through the hospital for sure is I always liken this with my director to Joint Commission. You know, they go through very stringent preparation for Joint Commission. This is our Joint Commission, and it really raised the credibility when you know, we let all of our medical team and anyone referring that, you know, hey, we've gone through stringent operational standards as well, and we've passed, and now we have the same seal of approval as the rest of the hospital has. And we made a big deal of it, and believe me, the credibility really grew, and the value of a medical fitness center became more important to the community as well as to the hospital system.
Yeah, that's great.
Well, thank you, Deb and Alan, for your time and insightful presentation. And also, you've set a world record for 87 slides in under an hour. So we appreciate that. I know there's a lot of information. If anyone does have any questions about facility certification, please feel free to reach out to the MFA office, or Deb or Alan would be happy to answer any of your questions as well. If you do have a question, please type it into the toolbar now. While I give you time to do that, I will read some MFA housekeeping. MFA would like to remind everyone to mark your calendars for our upcoming educational and motivational events. Our live webinars are free of charge to all medical fitness professionals, and please visit our online calendar at medicalfitness.org. Please join us for our 30th annual conference, which will be held for the first time ever virtually from November 3rd through the 30th. Registration is now open. There will be 2 live keynote speakers and 15 pre-recorded sessions, along with some virtual social networking. We hope to see you there. And Alan and Deb, you must have covered everything because we don't have any current questions. So I want to thank both of you for your presentation and thank everyone for attending today. And again, if you do have questions, please reach out to the MFA office. We'll be very happy to answer those questions for you. And I wish you all a great afternoon and stay safe and healthy for the rest of 2020. Thank you.
Thank you.
Thank you, guys.